Thank you, Howard. We are going to open it up to questions for a few minutes. We're running a little bit behind, not terribly shocking, but we will need to try to get back on schedule a bit. While folks are thinking about any questions that they might have, and we've covered a lot of ground in this panel, I did want to respond to a couple of questions that came in via the webcast. Again, we have two audiences that we're trying to manage here, the folks here in the room and a national audience via the webcast. One of the questions that came in had to do with where the program can be found, and so for folks who may be struggling to find the program, it can be found on the right of the page on which you access the webcast, and you can find it under the attachments section under something called briefing book. So hopefully that will respond to some folks that were having trouble finding that. Another comment, while much of what has been said so far today has focused on the fires of Northern California, particularly the Camp Fire and the Sonoma fire, we will be talking about the fires that have occurred elsewhere. This is a statewide issue. You, I'm sure, have seen the national television coverage of the Malibu fire and the fires outside or east of Los Angeles. So we will be having speakers bringing in perspectives from elsewhere in the state as well, although I suppose it's not surprising that we're a little bit Northern California centric based on where we're located. Let me ask now, we will be relatively quickly passing the baton to Dr. Wong in the second session, but let's take a few minutes for questions. If you would stand, and someone will bring a microphone around to you, and I would ask the speakers to identify themselves and then ask their question, and I would ask the speakers to try to respond as succinctly as possible. Yes, sir.
Hello, everyone. My name is Kevin Jenkins. I'm at the University of Pennsylvania, and my question is about water quality. And as far as, how long are you seeing the effects of water being tainted, if you will, and how long is a corrective process, or what kind of happens to help the water? Because I'm just wondering about, like, are these fires almost creating a Flint situation or something like that that could be long sustained that we wouldn't even know about?
While the folks are deciding who's going to respond to that, I would note that some of that will be touched on later when we talk about health effects, but Ben, you want to take a stab at it?
Yeah, no, that's a terrific question. And I think that these fires have a cascade of effects that can be long-lived is really an important theme that we need to consider, not only at the community level and education, but also the life support systems such as water. And a lot of the water contamination occurs through some of the flame retardants. There's aspects of household chemicals as the house is built, burn, and then all the chemicals are released into the local water systems. And then there's some toxins that can accumulate in the ash material itself. So it's hard to pinpoint a number. It really depends on the local hydrology and the wells and the rate at which the aquifers are recharged. But my sense is in the Camp Fire, you're looking at least a decade of significant impacts that can last in the local water contamination and then the soils and things like that. So, but again, it could be longer depending on the community, depending on how reliant they are on the local water wells and things like that. But it's a really terrific question that needs much more research, I would say.
David?
Yeah, and to that I would just add, that's for the long-term chronic. In the acute situation during the fire, the small public water systems are often compromised pretty quickly because we can have backflow if the pumps aren't on. And so we can have, much like Dr. Backer described, an incident within an incident, norovirus at a shelter. We certainly experienced some fear around evacuees returning home to no water or contaminated water and not knowing it because their well or their public water system pump was out.
Hello, John Balms, University of California, San Francisco, University of California, Berkeley, and the physician member of the California Resources Board. So I actually have two comments rather than questions. Though I appreciate how bad the air quality was in Sacramento, in November because of the Camp Fire. I just want to say that just because our AQI was worse than Delhi, that doesn't mean we had worse pollution. Actually, the AQIs for India are calibrated differently than the AQIs for Sacramento. So even though we got to over 300 AQI here in Sacramento, I was up here for a Resources Board meeting, it was bad air. In Delhi in November, that's not an atypical day. Often gets 800 micrograms per meter cubed in Delhi. Just to, you know, we have bad air, but Delhi's got worse. And the second point was the focusing on the paper by Mary Pernicki et al. These are collaborators of mine in Fresno. I know about the air pollution exposure data from that study. I'm sorry that study got a lot of press. I'm actually fine with the idea that we need to do more prescribed burns, and so maybe we don't have to worry about prescribed burns as much in terms of air quality, but that study is really flawed, so in terms of the exposure assessment. So I wouldn't put too much into that particular study, saying that prescribed burns are safer than wildfires in terms of exposures. It's the same stuff. It's just a question of the intensity of exposure.
Other questions or comments? We have one more up here, and Kathleen, if we have anybody on the line, I assume you will let me know. Okay.
Jackie Rezatar, National Environmental Health Association. My question is, what is the role of your environmental health divisions, and where were they employed in these scenarios?
So at the local public health, so I guess just, again, to level set, we're probably, compared to California counties, a pretty small local public health. So what's been, air quality has not been delegated to the local level. What's been delegated to us is groundwater for septic systems, and water quality advisement for drinking water, domestic water, and restaurant inspections. So that is the full scope of the breadth of local public health responsibilities in Colorado. And so with that, we focused on, again, the domestic water supply, small public water systems not having storage or, good pumping, and then making sure that when restaurants reopened post-fire, that they were also serving safe food. So we didn't have a norovirus outbreak.
Let me perhaps also respond. For many years, I was the Director of Health for California and actually did oversee the environmental health. And California is a little bit different in that some of the larger counties actually have their own environmental health division, which does all the functions, including the things that I believe you're thinking about. But for many of our smaller counties, particularly the counties that are impacted often by these wildfires, the state assumes that role for the counties, and having overseen the response to several wildfires during my tenure, I can tell you that the state folks were very actively engaged in monitoring the environmental aspects from both air and water and other aspects as well.
I just have one more question, sorry, there's a lot of passion in this. So at what point did you deploy your environmental health staff? And my question for asking that is, sometimes we think that environmental health staff is your first responder. And we're technically, in my opinion, professional opinion, not the first responders. But at what point did you deploy your EH staff to get into the restaurants?
The following, so it depended on when the evacuation areas were and how the fire was growing. But so the fire broke out on a Friday. We had our emergency preparedness and our health staff in over the weekend at our department operations center. We were participating in the county emergency operations centers, tracking where things were happening, and brought in our environmental staff as needed. They were not from our agency, our first responders. So I don't know if that helps, but we can, yeah.
Seeing no further questions, I'd like to move the agenda to session 2. We are not going to take a formal break, but I would encourage you, if you want to stand and stretch, and if you have biological needs that need to be attended to, feel free to do that outside. And likewise, if you need coffee in the next 1 or 2 minutes, perhaps you can go and refresh your coffee cups. During that time, I would ask the several panelists for session 2 to come and take their seats at the table, and Dr. Winston Wong, who I introduced earlier, will be moderating this session. So Winston, if you want to come on up whenever you're ready, and we'll just give people a minute or two to finish stretching and doing whatever else they need to do. And I would also note that this is one of the sessions where we're going to do a short video stream before we actually start the session. It's just a few minutes, but it provides some footage which may provide some useful context for the session which will follow.